in terms of challenges, okay, so I'll first talk about the germline part, okay. In germline part, technically now the things have become very, very streamlined, because now it's it's an ever improving technology, and we have the best equipment, we have the best of softwares. So the challenges that we face sometimes are just awareness, right? Just convincing the patient, or and it comes from, it's a challenge for us and the clinician both, just to convince or explain to the patient what are the implications of the test. It's very important to talk to the patient before the test, talk at length. It's called counseling. Tell and explain to the patient what we are going to do, what are we trying to achieve with this test, what does it mean if your test comes out to be positive or negative. We have to tell the patient both ways, like, if not to be too disheartened or not to be too happy, because so the counseling part is the most challenging for a germline testing, right? And then the post-test counseling as well, when we have to tell the patient that, okay, again, what does it mean to have a positive or a negative test? And I will talk about that also in further in this chat. But interpretation, interpretation of the results, it's very challenging and the most important part of the whole procedure. So as I said, we need to know whether the genetic mutations are disease causing or not, which is called a variant of uncertain significance. It's a gray zone. We can't call it positive or negative. That's again a next challenge. It's just interpretation and explaining the result, right? This was about germline. Apart from all the challenges which I'm facing in the germline, the interpretation and the meaning of the test, meaning of the results, tissue accessibility. Sometimes, there are, the tumor is at certain, as I said, the tissue has to be taken from where the cancer is, right? Sometimes the cancer is at a very inaccessible location. Sometimes a biopsy is very, uncomfortable for the patient. The patient is already in a morbid condition, and then a biopsy becomes an added stress to the patient. So these are the major challenges. Apart from interpretation it can be sorted out by just interacting with the clinician. We try to talk to every clinician and explain the result and discuss the results with the patient, in keeping the clinical picture in mind. So that becomes very important in these kinds of tests, because because the interpretation of the test can really change the treatment plan and treatment protocol of the patient. So these are the major challenges that one faces. See, setting the right treatment plan is more up to the clinician. Right?
Yeah.
What we do is, setting the right treatment plan is more up to the clinician. What we do is giving the as a diagnostician, what we do is giving the right information to the clinician for him or her to make the right treatment plan. There are certain treatments where they need to know whether this mutation is there or not. A positive or a negative is equally important. So the test has to be so sensitive, the interpretation has to be so good, that the clinician gets the exact information, and we try to give as much clean information as possible and not work around gray zones. But it's medicine, it's never 100%. So that's important. The treatment plan is prepared ultimately by the clinician. What we can do is only assist them or help them in making that plan. So and that is always the role of a diagnostician.